Okay, now what do you do with all of this? You know that you have this buildup of B6 potentially. If your B6 syndrome was due to taking too much B6, you have this buildup of B6 that is causing damage to your small fibers and maybe over a long, long period of time your large fibers as well, and causing these symptoms that you're having, somatic symptoms, autonomic symptoms, central nervous system symptoms too. What do you then do? Um, Unfortunately, we have this artificial divide put up for people between Western or allopathic medicine and alternative medicine on the other side. And in my humble opinion, the sort of standard default approach of both of these alleged spheres is really lacking, just to put things lightly. Um, so let's say, for B6 toxicity in general, on the allopathic Western kind of conventional side, first of all, of course, there's the problem of just under recognition. Most physicians and doctors don't know about B6 toxicity, and even if they do know about it, they don't know what to do about it. So they're not even considering it in their differential when they're looking at your symptoms. They're not even considering this as a possibility. If they see you have neuropathy, they'll just probably assume you have diabetes or something like that, um, or idiopathic neuropathy. And you have depression, you have these central nervous system symptoms, you have migraines. This is just something that we can't figure out. We need to put you on SSRIs or triptans or some kind of migraine medications on the allopathic Western side. Um, for those on the allopathic side that do know about B6 toxicity, the approach is still limited in the sense that they simply treat B6 toxicity as a diagnosis based on pretty limited parameters, and then you follow a treatment protocol. And that treatment protocol essentially consists of avoiding B6 in supplements, limiting but not over limiting B6 in food, um, and avoiding vasodilators, emphasizing hydration, and so on and so forth. That's a great approach for certain types of B6 toxicity or vitamin B6 syndromes. It's a great approach and it's a great adjunct to more personalized therapy. The problem is that that approach discounts the existence of other forms of B6 toxicity, and it discounts underlying systems deficits that cause you to get B6 toxicity, that make you vulnerable to B6 toxicity. That's the Western approach. On the alternative, quote unquote, medicine side of things, we have this very, very unfortunately shallow approach. And by the way, I'm not accusing all alternative medicine of this. I'm just saying that some of those who basically ascribe themselves to alternative medicine take this very shallow approach of you have high B6 levels in your blood. That means you are not getting it into your cells. You need to take P5P. That simply is not. That's not right. That can cause further damage, and a lot of people get toxic on P5P, even though it may be slightly less likely to cause toxicity. Now, the problem is one of the problems is the whole framing of this divide. So, what makes alternative medicine alternative medicine? Is your medicine alternative simply because um, it is alternative? Because you're just doing things that are non conventional? Are we just doing those things because they are, non mainstream? That's not why we want to do those things. We want to do the things because they have some sort of evidence behind them. That evidence doesn't have to be randomized controlled trials. That's one of the excesses of modern quote unquote evidence based medicine. But there has to be some form of evidence behind it, something. And on the Western side, the quote unquote Western allopathic conventional medicine side, um, the body is looked at in a very fragmented manner where we don't see the body as a coherent system. Rather, we see the body as something that manifests certain diagnoses that we need to simply identify so we can follow treatment protocols. Um, so, the goal is I really I'm calling people with B6 toxicity to basically pull themselves out of this artificial binary. this is not how treatment and healing works. Healing works by applying what I think is necessary in pretty much all cases, and especially B6 toxicity cases, a personalized framework. So you need to really understand what's happening. You have to understand your body. You have to understand what is causing you to feel bad, what is causing you to have this apparent manifestation of B6 toxicity. You understand why you have what you have, why you are manifesting what you're manifesting, and then you address the why. You don't address the manifestations.